Welcome everyone to Viral Buzz Healthcare channel. So today with us we have Dr. Noor, who is an healthcare industry expert of over 37 years, and he is the director of Path to Care Services. So Dr. Noor sir, welcome you to the channel. So just let us know, introduce yourself and let us know what this Path to Care Service is about.
Thank you so much for giving me an opportunity to give you clarity on Path to Care. Okay, I am Dr. Noor with 37 years of clinical experience in handling various patients in various diseases. Okay, so and also associated with various hospitals, super specialty and diagnostic centers also.
Okay.
And some educational institutions, medical educational institutions. Okay, today I feel very privileged to be talking about Path to Care. Okay, so and also associated with various hospitals, super specialty and diagnostic centers also.
Okay.
And some educational institutions, medical educational institutions. Okay, today I feel very privileged to be talking about Path to Care.
Yes, that's basically past these few years, I think we have conducted many health camps and you might have served thousands of people. Yes. During this experience, when you take India as a scenario, how do you compare the healthcare that we have in India when we go outside countries?
This is also a very good question. Okay, health issues in India, most important, which create mortality and morbidity, are heart and brain. Okay, other infectious diseases and all are there, but they do not incur that kind of expense.
Majorly mortality is because of heart care and
brain stroke. So what we have done while screening the patient for issuing a P2C card, we do a very preliminary analysis of their investigations and clinical condition.
Of the patient,
of course. Okay, and after doing that, if we notice even a small error somewhere, further investigations are done to prove it, that this needs to be corrected, this needs to be attended to. But what happens is, patient is not really threatened. You understand? He has other priorities like maybe children's fees or maybe some automobile EMI, or so many things are there.
Daily show.
Okay. So he would say that, okay, as on today, I may not need it. When it really needs, we'll look into it.
General people.
That creates a problem and makes the bill big. Where affordability, we are losing. By screening, we are able to get into that affordability category.
Yeah.
You understand? So, it is important that we emphasize to the patients that you undergo screening, you look into it and finish it.
So, let us take one perspective from the audience side, okay? So, in general, nowadays patients, okay? So, they go on these bookings, everything, isn't it? What is the primary mistakes these people do in actual opting for this healthcare services?
This is partially overlapping with our previous concept that we elaborated. Okay. Here again, what they feel again is the same again. That is, they have other priorities. Okay. And they wait for clinical symptoms like pain, like breathlessness, like weakness in some part of the body. Okay, and then when overnight in the mornings they wake up and they are not able to speak because of paralytic stroke, that is when they realize, then of course to correct that will take time, it will take money, and will take a lot of pain also.
Yes.
So to avoid this, we always, again I tell you, that we take preventive measures and we educate the patient that it is better to attend to it now than later on.
Sir, nowadays, this healthcare, it is being very often treated for being transactional. So now and then I hear from many people saying this. And everybody thinks that they are just a number in the list. Okay, how do you respond to this question?
Yeah, this is an excellent question. Okay, it is also linked to the affordability. Okay. Here what happens is, healthcare system, hospitals take so much of loan, crores of rupees investment, and they are sitting there to look into the healthcare.
Yes.
So involuntarily, from some side or the other, it will come. So we are addressing to it by doing proper counseling, and also by talking to the correct doctor and talking to the hospital upon the affordability of the patient. Okay, patient just don't need treatment.
Yes.
This most of the people forget.
They need a service.
No. They need service, of course. But what they need is a helping hand.
Yeah.
You understand?
Yeah.
A helping hand plays a very important role. Just hold the hand of the patient and say, I'll take care, you don't worry. Okay, that plays a very important role. And sitting down and talking some other points away from healthcare also relaxes his mood. Okay, ultimately giving him assurance and reassurance that we are there for you, we'll take care. We'll call you for some routine checkup, or maybe do some investigations which are associated with the disease which you are admitted or the condition that you are admitted. Okay, and we also will give you clarity on your health status. Oh, it has improved a lot. You are much more comfortable. You don't have to worry. These are the words we use to give them reassurance. They need somebody to listen to. Okay, where if you're just talking about health needs and all, we should hold hand, be compassionate, don't worry. Give a tap on his cheek
And say everything is good.
Everything is going to be all right. That makes their world much more beautiful. They'll forget what treatment we have given. They'll remember these words which we have spoken.
Because good words heal the person more than the...
Confidence. Give them confidence to the person
Yes.
to get off the bed.
Yeah.
Right?
Sir, one final question I have for you, sir. So after hearing what this Part 2K services is, and what are the options it provides to the people, the general public, okay, who are in need of this healthcare system, okay, like I see it as a very good thing which is not there in the industry at all, okay. So from your side, I just want to hear how much good it will do to the people if they offer this service, and how much confidence will you give them when they offer this service with you?
Yeah, that's true. Again, I repeat, we are giving them excellent healthcare by selecting the proper hospital, a proper doctor, okay, taking care of their financials, taking care of their preventive measures, taking care of their some health checkup again, okay, and doing some investigations that prevent any complications that have occurred in the present health scenario. Okay, this not many people will address. We'll just give a discharge summary. You just come for review, or they'll come for review. They will see, oh, everything is all right. Now you don't have to worry about the heart. Then what about the kidney? If something is happening there, that they don't have. They don't bother.
Yes. So you mean to say with Path to Care, we'll be having a comprehensive health care service. Thank you, sir. So thank you very much for coming to our studio and letting us know all these things. Okay. So it is an excellent product that I have never heard about it. Like, it is an excellent product. Okay. So if it is there into the public, it will penetrate very deep into the public, and this will be very good for the public as well, because what are the services you are providing, which our current health system doesn't have, will prove very good for the customers going forward. So thank you once again for coming to our studio and helping us through all these things. Okay, hope Path to Care will become a very big hit in the future.
Thank you once again for giving me the opportunity.
Thank you, sir.
To enlighten on various aspects of healthcare. Okay, I feel very privileged in making you, and indirectly the public who will later on see, will get to know more about their healthcare.
Definitely.
Thank you so much.
So going forward, we will be doing many other...
Definitely. We will enlighten
like this.
We will enlighten them on various more options.
Definitely.
More
Sir, part to do.
Yeah, definitely. More and more.
Thank you, sir. Thank you a lot.
Thank you so much.